Now, as of yesterday, we have administered a total of 46,791 doses of the Pfizer and Moderna vaccine to long-term care residents, respiratory therapists, ICU nurses and doctors, and other frontline healthcare workers. So we should be clicking past 50,000 doses administered by the end of today. We've used more than 3/4 of the vaccine doses in our stock. That's the second highest amongst major Canadian provinces in Canada. We've increased our daily vaccination administrations from an average of 878 in December to an average of more than 3,800 per day in early January. Every day we are taking steps to improve our vaccination campaign and expand eligibility for priority groups. The teams at Alberta Health Services, Alberta Health, and the COVID-19 Vaccine Task Force have proven to Albertans their ability to adapt, to pivot, and to ramp up quickly. We've made significant progress in long-term care and designated supported living facilities, with 398 facilities in the process of receiving the vaccine. And Alberta is on track to complete vaccinating long-term care and designated supported living residents in all health zones by the week of January 18th, that is to say, next week. In fact, the North Zone will complete its vaccinations of their residents by the end of the day today. This is very good news because, of course, these are amongst the most vulnerable people to COVID-19, and we are within days of having completed the first dose for those particularly vulnerable seniors. There are three critical components to our continued success. First, we must have the staff and resource capacity to deliver the vaccine. Now, as I mentioned, I'm pleased with the ramp-up that Alberta has demonstrated in this area, but this will be an ongoing effort as the inoculation campaign continues. Second, we have to have an adequate and ongoing supply of vaccine doses arriving through the federal government. This is absolutely critical. We can only work with what we've got. Thirdly, we need Albertans to sign up and to get the shot. We'll have the capacity to deliver, but we need as many people as possible to receive the vaccine. Last Thursday, I had a call with the Prime Minister and with other premiers across the country to discuss vaccine supply. And I conveyed to the Prime Minister, as well as have my colleagues, the urgency of getting as many doses delivered to our province as possible, as quickly as possible. The federal government signed exclusive contracts for Canadian supply of vaccines, so Alberta cannot legally procure its own separate supply, at least not with respect to the three vaccines currently being used globally, the Pfizer, Moderna, and AstraZeneca. We are not alone in our concerns about the supply of vaccine, especially as our pace of inoculation continues to pick up and there are millions of Albertans waiting their turn. In the meantime, my direction to Alberta's health system is clear: to create the fastest possible system for inoculation, driven by urgency despite the projected and current supply shortages. That's why we are here today. I'm pleased to announce that we are expanding our vaccine program even further than originally planned at this point. Starting right away, paramedics and emergency medical responders will also be eligible to receive the COVID-19 vaccines. Minister Shandro will go into further detail about this in a moment. We are now in a position where we can rapidly administer volumes well beyond what we are, in terms of the doses that we are currently being provided with. By the end of January, I'm confident that we'll have the capacity to administer about 50,000 doses per week, and we'll continue to increase our capacity, partly by partnering with pharmacies across the province. Our stretch goal is, for the end of March, is to be able to vaccinate up to 200,000 people per week. Of course, this is all dependent on the number of vaccine doses that we receive. In fact, based on the current schedule for expected new supply, we are set to effectively run out of vaccine doses about a week from now. Our plan to ramp up the rollout requires as well that we have a lineup of Albertans ready to get the vaccine. So far, we've built up a large group of eligible healthcare workers and seniors to vaccinate, and we'll only be adding more to those priority lists in the weeks to come. By expanding eligibility to paramedics and emergency medical technicians today, we and staff in COVID-19 units and medical surgical units last week. That's what we expanded it to last week. We are well on our way to get the those populations immunized. Plans to vaccinate Alberta seniors in the general population who are over the age of 75, as well as those in First Nations communities over the age of 65, will be announced very soon. And let me just add that the reason for the age differential there is that unfortunately we have seen significantly worse health outcomes from COVID-19 for people in our Indigenous and Métis communities. The bottom line is this: Alberta's capacity to give people the jab will soon outstrip available vaccine supplies, and we're doing everything humanly possible to roll out these life-saving vaccines as quickly as they arrive.
This expansion of eligibility is important as we ramp up our efforts to get as many doses in the arms of healthcare workers as well as vulnerable Albertans as possible. Alberta Health Services will use their existing online booking system to arrange for the vaccination of these newly eligible healthcare workers. And I know there will be questions about when we can expect to see the rollout expanded even further here in Alberta. I ask that you be patient. We are waiting for additional vaccines to arrive. And I can appreciate the concerns everyone in the community has. My own parents are both in their 70s, but not yet 75. They're waiting like all of us at this time. But we all have and share a commitment to work as hard as possible to continue to ensure that vaccines get to Albertans as quickly as possible while ensuring safe and reliable delivery. The bottom line, we are here for you. We want every Albertan to get the vaccine as quickly as the federal government provides them to us.